Hello, everybody. Welcome back to another episode of the Decoding Health podcast. I'm your host, Dennis Kamara, and our guest today is Jannine Versi, the co-founder and CEO of Elektra Health, a company that's redefining menopause care for the digital age. While menopause affects roughly half the population, it's often shrouded in silence. That's where Elektra Health comes in. They're on a bold mission to smash the menopause taboo, providing millions of women with the support, resources, and community they've long deserved. Let's dive into how Elektra Health is leveraging technology to change the conversation around this critical aspect of women's health. Please welcome Jannine Versi. Jannine, thank you so much for coming on the Decoding Health podcast.
Thank you for having me, Dennis.
Of course. So your early career path is just super fascinating. You were a humanities student at the University of Pennsylvania, and I understand that led you to work at a very trendy cookie startup. Can you just talk about how that experience led you into the world of entrepreneurship?
Sure. The two humanities and the cookie startup were not related. They just, happened to take place at the same time. But I was an undergrad looking for a part-time job, and I stumbled across a position, which was a part-time baker at a cookie company. And I didn't really totally understand what a startup was at that time. I was a freshman at Penn. But I started out just helping in the kitchen, baking cookies, and the company, Insomnia Cookies, is now on most major campuses or large metropolitan areas, so people may know it. But at the time, it was just a couple of guys that basically started this business out of the proverbial dorm room, except it was a kitchen, kind of like a ghost kitchen. And next thing you know, I was helping them strategize, how do we expand this thing? I was overseeing a team of bicycle delivery folks. And it was just so fun. It was so fun to see how quickly it grew and how the work that we were putting in translated into real impact, growth and change in the business pretty quickly. And so it was fun. Who doesn't love baking and delivering warm, fresh cookies and brownies to hungry students well after midnight? So lots of things to love about it. And I think it did cultivate in me just a passion for kind of high growth startup entrepreneurship type opportunities.
Shout out to Insomnia, because they do have really amazing cookies. And you've been able to work, you talk about high growth startups, and you've been able to work both in the public and in the private sector as well. And right now, you're focusing on menopausal health. I'm just curious why that's so important for you, and what personal experiences led you to co-found Elektra Health.
Yeah, I focused on digital health for the last, call it, better part of the last 10-ish years. I did spend some time in the Obama administration, did probably 2.5 years of public service in that time, but was really interested in this intersection of health and technology. And it just happens to have been this time when digital health has really exploded. Starting with the electronic medical record, which doesn't feel so innovative anymore. But in 2012, when I was starting to look into the space, it was pretty foundational, and it has enabled a lot of really fascinating innovation. In terms of the focus on menopause, I think having worked on different parts of the digital health ecosystem, in behavioral health and musculoskeletal focused startups at Cityblock, which has got a much broader remit around advanced primary care and behavioral health and social determinants of health. I kept sort of thinking about, well, what does women's health look like in this innovative new realm, and was excited by the companies like the Mavens and Kind Buddies of the world that were looking at much more of the reproductive window. And I personally have been through many of those journeys, the family building journey, the fertility journey, the complex pregnancy journey. But when you think about where the innovation is needed most dramatically, in my view, one of those areas, and we don't have to pick just one, but one of them that is so overlooked is how we think about women's health as we age. I'm one of 3 daughters. I was a primary caregiver for my grandmother, who in her 80s was struggling with frail bones. She was bedbound. It was not the way that I think anyone, but women in particular, want to age. And there's so many aspects of sex-specific health, including bone density as just one example, cardiovascular risk is another, that we don't do a great job thinking about from a preventative care perspective, a chronic disease perspective, and a quality of life and quality of outcomes as we age perspective. And in my view, that starts with the menopause transition. And so that's part of what led my interest. And I could say much more about that, but I'll pause right there because I think that's a handful.
There are certain areas you mentioned, pregnancy, fertility, postpartum care, where it seems like there's been a lot of attention on those issues, rightfully so, because they are super critical.
Correct.
But menopause also deserves its share in the spotlight as well. And there's been a lack of research in the space. And one thing that I had noticed about Elektra Health that you all did is that you all do a lot of research and you publish that research as well. So last year you did your menopause cost report in order to share what the healthcare costs are for women going through this condition, which again, kind of a plug for any digital health founder that's listening. It's really important that you do evidence-based research, but also share that research so that your customers, your investors, just others within the space as well, payers can understand what's going on. So I just love to be able to understand more about how you approach this research and if there were any key insights that you were able to gain.
Yeah, absolutely. I think, first of all, you're totally right that we need all digital health focused founders, investors, stakeholders to contribute to the research because we need so much more of it. And it is pretty nascent just across the board. If you look at who's really publishing anything around interventions or utilization or cost savings or any of the metrics that we care about if we're thinking about improving costs and improving outcomes and reducing costs. But in Elektra's case, when we work with health plans, we are often asked, well, basically, pregnancy is a high cost event. Fertility is also a high cost event. That's, often something that employers are more fixated on. But at the end of the day, these two aspects of women's health are associated with costs that could be avoided, reduced, improved. And there's a prevailing sense, inaccurately, in my view, that menopause is a niche. It's a small thing that happens. It's not as the morbidity and mortality is not so significant, and it's not costly. It doesn't jump off the page in terms of a list of costs associated with menopause ICD-10 codes, and that's actually not totally correct. I liken it to the research that was done in the behavioral health space 10, 15 years ago, where there was really an aha moment around return on investment in behavioral health when you start to look not just at the behavioral health condition and the cost to treat that condition. Antidepressants, for example, are not very expensive. So the intervention, the treatment is not high cost that needs avoiding. But when you look at the impact on all of the chronic comorbid conditions that a person is navigating and the impact of untreated anxiety and depression on our overall health, then you do have this really clear picture emerge. And that has since been borne out. But I worked in the behavioral health space 10 years ago, when that conversation was still nascent. And I think in the menopause space, we're trying to do something similar, which is connect what's happening in menopause for women 5, 7, 10 years of their lives. Not optional, by the way. Not everyone is going to be a parent or navigate infertility, but like puberty, all women who live long enough are going to go through menopause. And the research is very clear that it impacts our broader health as we age in that time of life. And women with untreated menopause symptoms, when you look at claims data, and this is what we did in that study, you find that women who have symptoms that are not treated or managed do cost payers more per woman per year, significantly. So we really need to, I think, tell that story more effectively. And part of that research is a way to shine a light on the costs of untreated menopause, and also to connect it to, we see higher associated costs by areas like behavioral health, actually, joint and musculoskeletal pain, cardiometabolic illness, diabetes, hypertension. So menopausal women are costing the system more in general, and substantially more in those vertical areas. And so I think part of the goal is to paint that holistic picture around costs and opportunities to improve health and reduce those costs.
I love that you, as you mentioned, you are painting that picture and making it very clear, the burden and the financial implications of not addressing the issues that menopausal women are going through. And it's also surprising that, again, this issue is just getting the attention that it deserves, considering that a little over 1 million women enter menopause each year, and that doesn't even account for the women that are kind of going through the transitionary phase before entering menopause. So I'd love to just dive in more into how Elektra Health works. So could you walk us through a bit of your service model and how you're leveraging technology in order to provide evidence-based care, education, and community support for women that are navigating either the stages before menopause or menopause itself?
Yeah, absolutely. So Elektra is a fully virtual digital health solution, and we help women navigate and receive appropriate medical care and treatment for their symptoms and their health in these midlife decades. So that's typically the 40s, 50s, 60s. We have patients that are older and younger. And so it's a full stack virtual clinic. And we do telemedicine care provided by board certified providers, and they tend to be family medicine physicians or gynecologists with special training and expertise in menopause medicine. And there is a certification that providers, they have to study for and take a test, and to receive a certification by the Menopause Society, so the medical society that is focused on menopause research. And then also sexual medicine, which is really an important part of the concerns that women are reflecting in this time of life, but that often go undiscussed, or, sort of are overlooked, let's say, by often traditional either primary care or OBGYN care. So that is what Elektra does. But part of what makes our model unique is recognizing there is not enough access to menopause trained providers, and menopause and that midlife era. So the preventative care, age related screenings around cancer, whether that's breast cancer, cervical cancer, colonoscopies. There's a lot of education that is required that is very challenging for providers to cover in a typical 15-minute visit. So Elektra has built a platform which has all of that education. It's written, it's audiovisual, it's actually funny and engaging and entertaining. It's not like boring Wikipedia style paragraphs of text that is kind of impenetrable. And so it is a way that we engage individuals in their own health and help to empower them and give them the opportunity to make informed decisions about their care with that education, but also with access to our menopause doulas and guides. So these are healthcare professionals, but they don't have to be clinicians. They may be retired clinicians who are really good at providing that one-on-one expertise. They often bring lived experience, culturally relevant experience, language, where if there's Spanish speaking women that would prefer to converse in Spanish and receive like their wellness plans in another language, we will accommodate that as much as we can. And the goal there is really to build a trusted relationship that is focused on the menopause experience, but extends more broadly into midlife. And that also means that with the data we have, we can more efficiently and effectively clinically treat people. So right provider, right time, right duration, and leverage all of that engagement to ensure a great experience and stickiness over the long term.
I like super love that. I even looking at you all's website during the while I was researching, you talk about how you're smashing the taboo of menopause. So I love that you're making it accessible to
Thank you.
a wide variety of different groups. So, and as you mentioned, like menopause has been a taboo subject, and it's often been misunderstood or just ignored in broader healthcare discussions. Again, that's very sad because it leaves millions of women to have to navigate and advocate for their own care. But I do think that with this awareness and through discussions like these and through what you're building, there is an opportunity for systemic change. So I'm just curious, what changes would you like to see from the healthcare system in terms of how they approach the care for women that are going through menopause?
Yeah, I think first of all, I would love to see the metrics that are used widely. So HEDIS, for example, those types of quality measures and metrics that our healthcare industry uses to assess our providers and payers enabling health, they should include menopause, which 51% of the population is going to experience and is, pretty fundamental to the health of women. We know that decline in estrogen, for example, does affect brain health, bone health, other realms of health that drive outcomes and costs. And so we should actually think about how do we approach healthcare quality as it relates to the menopausal years. I think that would change things more dramatically than really anything else. That being said, I am thrilled that the president has talked about menopause from the podium, that Dr. Jill Biden is championing an initiative to bring more research dollars in, whether that's to the NIH or to other institutions. I have actually applied for multiple NIH grants, and some of the feedback I got a few years ago was this type of thing isn't necessary, that, we're good as it relates to menopause education, support, and digital solutions. And that couldn't be further from the truth. But it does seem like we're having a bit of a cultural conversation around menopause and women's health and aging and longevity. And I think that that's really important. So back to smashing the taboo, every conversation, every discussion, every thought leadership keynote or kind of research undertaking that is focused on quality of life and health and longevity should include this topic. And I think we're starting to see some really promising signs on that front.
I also just want to give you your flowers for that last statement in terms of hearing negative feedback about how false feedback about how this is an issue that's pretty adequately addressed, and knowing there's a lot more that needs to be done, and just pushing through. I think it's so easy to be discouraged by people. So the fact that you were able to push through and here you are now continuing to build a very successful company and addressing a very key underserved group, it's just powerful. So I just want to make sure you get your flowers for that one.
Well, no, I appreciate that. But I think it is this area where women themselves have not traditionally been invited to speak up about it. That's how the taboo works, right? Like this concept of we don't really hear about it, and therefore it's probably not really an issue or it's not really a problem. Well, no, that's the definition of a topic that is stigmatized and taboo. It is not spoken about. We don't encourage it. So, ergo, we have the system we have. And so I think that the, reason becomes the explanation for why there are so many deficits. But it's multifactorial. We could look at any sort of trend, whether that's in physician training or reimbursement, or just what do we value in our society when it comes to women's health, and how it tends to be much more focused on the reproductive window and women who are actively becoming mothers, which is great. We do need to focus on that, and we do need to do much better in that space, but it is not mutually exclusive from thinking about women's health as we age, particularly as we are, often in the menopausal years, carrying the heaviest weight of the sandwich generation caregiver burden, plus working full-time and working longer and later in our lives and careers, because that's what, our society is requiring of us. And so I think it's a false choice to sort of pit different phases of the female life course and health course against each other, but we somehow do fall into that trap over and over again.
Gem after gem after gem was just dropped. Oh, y'all, Jannine is dropping gems. There's one last question I do want to ask, and you've kind of hinted at it. I think there's whether we look at physician training or whether we look at reimbursement, I think there's a lot of areas that can be addressed. I do want to come back and think about the patient themselves, or the woman that's going through this experience, because oftentimes there's a lot of misinformation or a societal stigma. I think about the women in my life that I grew up with, and for them and their generation, they just kind of suffered through it. It was kind of just something that they didn't want to have anybody know about. So, you've had a lot of experience in this space of menopausal health. So if you could give one piece of advice to women who are either approaching menopause or going through it now, what would it be?
I would say that you deserve to be able to make an informed choice about your health and well-being in this time of life. And that isn't just around this question of, do I take hormones to manage symptoms or not? It is a much broader question, because we live in a state of perimenopause to postmenopause for 40% of our lives. So I think it's just the opportunity to think a little bit more broadly about, how do I want to live? And if you are someone who feels your symptoms are manageable, they don't affect your quality of life, that's great. Probably you also should be educating yourself around how your muscle mass changes and your bone density changes, so that if you want to avoid falls, fractures, and breaks 10, 20, 30 years down the line, there is still something important for you in this conversation at this time of life. And then, of course, for the 85% of women that report symptoms, some of which can be severe and debilitating, you absolutely deserve access to care. And if your provider is not supportive and is not having an individualized conversation with you, even if you really like them, you can say, okay, great, I'm going to go and seek this care elsewhere. Go to menopause.org. That is the Menopause Society's homepage. Check out Elektra, check out other resources. There are many at this point, many more every day, that are offering trustworthy, science-based information. And then you can make an individualized choice based on your risks and your benefits and your medical history and your preferences. And you deserve that. We all deserve that. So maybe more than a few parting words, but I really believe strongly that this is not a doom and gloom phase of life, as it's sometimes painted to be. We talk to a lot of women who are able to manage the symptoms that come up and live well and feel like there is a liberation to this time of life and a freedom that they haven't necessarily experienced before. And I think that's something really positive that we can all orient around. So those would be my kind of final concluding thoughts.
Well, I love that. You all, as Jannine said, you all deserve the quality care. So make sure to seek out the resources that were just mentioned. Jannine, thank you so much for coming on the Decoding Health podcast.
Thank you for having me. Take care.